Hello and welcome everybody. Welcome to our meeting, and Heather has, as usual, a packed full of exciting information. I'd like to first have our roll call taken and make sure, as I do believe we do, we have a quorum.
Great, Madam Chair, thank you. Heather Corbula for the record. I'm happy to call the roll. I just wanted to also remind everybody that is listening on attendee zone or mode, if you have public comment during our public comment section or agenda items, please go ahead and raise your hand or put something into the chat box that you would like to speak. And before I call roll, Katie, if you could add A. France to the list of panelists, that would be great too. Thank you. So I'll start with Dr. Florence Jameson.
Present.
Valerie Clark is absent. Levon Lewis. I see you and your camera seems to have frozen. Is everyone else seeing that too? Okay, so we will mark you as present, Levon.
Yeah.
Oh, I can hear you now, thank you. All right, Dr. Friedman.
Present.
Jonathan Johnson.
Present.
Jose Melendrez.
Present.
Quincy Adams is absent. Is Suzanne Bierman joined us? Oh, she's in, I see she's in the attendees. Katie, if you could also join her to the panelists. And I will mark her as present. Commissioner Richardson?
I'm here.
Great. And Aaron France?
Aaron France is present.
Thank you. Thanks for being here, Aaron.
Thanks for having me.
Great. So Madam Chair, we have a quorum.
Excellent. Let's see, I just had my agenda here. Go ahead and let us first, after welcoming everybody, ask if we have any comments. Any comments, public comments?
Katie, do we have anybody who's raised their hand? Again, if you would like to make a public comment, please go ahead and raise your hand or put something into our chat box and we will allow you to speak on the Zoom meeting.
No,
Katie, are you seeing anything?
Nope, I'm not seeing any.
Great.
Okay.
In that case, I would love to entertain a motion from one of our board members for the approval of the minutes from July 21st, 2020 board meeting.
Jonathan Johnson, motion to approve.
Jose Melendrez, second.
Everyone in favor of approving the minutes from July 21st, 2020 board meeting, please say aye.
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 Anyone opposed? Is there anyone who's abstained? So the minutes from July 21, 2020 board meeting have been approved. And at this time, we are all been excited and waiting to hear our executive director's report. Ms. Heather Corbulic, we are ready to hear about all the exciting things you're doing for our new enrollment period. Thank you.
Thank you, Madam Chair and members of the board. I just want to remind all of you and anyone who is listening that you can follow along with all of our material at our webpage, nevadahealthlink.com, under the board meetings section. All of this material is posted there. And so with that, I will just, before I start reading my more formal comments, let you know that sometimes people think that the exchange maybe doesn't really have a busy time before open enrollment, but I can assure you that that is not at all the case. It has been a bit of a wild ride, and I'm actually looking forward to being in open enrollment when things might settle down slightly. So with that, thank you again for being here. I want to just let you know that we've spent the summer months of 2020 settling into our new normal, while also preparing for our second open enrollment period as a fully autonomous state-based exchange. This preparation work includes developing new partnerships with our QHP carriers, the creation and development of new marketing campaign strategies, eligibility platform changes, and of course the corresponding testing, our agency's biannual budget and the development of that budget, state agency partnerships, and then of course tracking and monitoring the ever-evolving field of federal policy and rule changes. We have learned an enormous amount over this past year, and we remain confident that our 8th open enrollment period for Nevada HealthLink is going to be one of our best. So I'm going to give you an overview of what's to be expected for plan year 2021. Window shopping for plan year 21 went live on October 1st. The exchange is proud to announce the participation of 2 additional qualified health plan carriers for a total of 5 QHP carriers for plan year 21. Nevada consumers will be able to choose from a combined total of 50 health plans from returning carriers, Anthem, Health Plan of Nevada, and Silver Summit, and our new carriers, Friday Health Plans and Select Health. 6 returning dental carriers have submitted a total of 21 standalone dental plans, and Nevadans living in Clark and Nye County will be able to select health plans from all 5 of those carriers. Washoe County residents will be able to select health plans from Anthem, HPN, Friday Health Plans, and Silver Summit. And then the 14 remaining counties, we're very excited to announce they'll have an even more selection this year. They will be able to select health plans from Anthem, Friday Health Plans, and Silver Summit. The average rate increase for plan year 21 is a 4.2% for on-exchange plans. We continue to remind and message consumers that when rates increase, subsidies also increase to offset that change. So consumers, the bulk of them, 80+% who receive subsidies will see little to no impact resulting from that rate increase. Open enrollment and an overview on our marketing and outreach campaign, which you get to see a sneak peek of later on during the presentation, and get more information from Janelle Davis, our communications officer. But I'll give you my perspective at a 50,000-foot view of what we've been working on. Every facet of the exchange has quickly adapted to the COVID landscape, and none more so than the exchange's marketing and outreach efforts. As a small standalone state agency, the exchange has always been very nimble. That ability to be nimble has proven extraordinarily useful throughout the pandemic, and especially as our agency heads into the open enrollment advertising season. The exchange, in partnership with Penn and Powers, has developed a comprehensive advertising campaign that speaks to the reasons for getting coverage and highlights people living within the realities and the confines of COVID. The campaign targets newly unemployed Nevadans, gig employees, culturally diverse populations, parents, among many others. This year's campaign strategy takes from last year's successes and builds a robust digital and social campaign and all Nevadans are bound to encounter throughout their daily lives. The exchange and our outreach partners throughout the state have been forced to think creatively when it comes to meaningful outreach and engagement. Early on in the pandemic, our in-person events and conferences were canceled, and online conferences and events do not easily lend themselves to meaningful engagements with potential consumers. In response, the exchange staff have delivered promotional and educational material to schools, churches, health centers, and other entities who are directly interacting with Nevadans throughout the pandemic. To accommodate social distancing requirements and to prevent prevention of COVID, exchange navigators are providing virtual assistance to consumers via Zoom and FaceTime meetings. Navigators use these technologies to provide face-to-face and advice and then walk consumers through the application process while they remain safely at home. While this has proven to be a preferred method of assistance, navigators are scheduling in-office appointments if requested, but they do so with the limited number of consumers and staff in our navigator offices and they follow all of the CDC guidance and recommended safety requirements. In addition to the new processes for individual assistance, new procedures for outreach events have been developed. Our navigators, of course, have always been and are the primary event staff for to represent Nevada HealthLink at community events. While public gatherings have drastically been reduced since March of this year, some still do occur. And to ensure that the safety of both our navigators and our consumers and fellow Nevadans are protected, navigators, of course, again, comply with all of the CDC and state transmission safety measures, including the use of PPE, social distancing guidelines, gathering limits, and table and booth disinfecting. We have wonderful and very exciting partnerships going on with our brokers and navigators this year. So in July, the exchange announced our licensed broker, agent, navigator, and in-person sisters that were selected to receive our grants for Plan Year 21. The program is, of course, designed to help close the uninsured gap in Nevada by helping those on the front line to more effectively market to uninsured and underinsured populations. In May, our licensed broker agents, navigators, and in-person assisters applied for the program and provided us with detailed outlines on how they would use funding for marketing, outreach, and operational costs, with the goal, of course, of increasing enrollees. In light of COVID-19, this year's applicants were also required to outline how they would implement social distancing and community mitigation strategies to reduce the transmission of COVID through the duration of the performance period, which will run July 1st of this year to June 30th of 2021. We awarded these grants to brokers and agents. There are 5 different brokers and agents, including Brian Douglas, Brent Levitt, Chris Carruthers, Albert Ochoa, and Gina Aguirre, who is new and in the north, and we're very excited to have her this year. We have also awarded the grant to 8 in-person assister and navigator grantees, including Asian Community Development Center, the Asian Community Resource Center, Access to Healthcare Network, which we're very excited to have rejoin us after several years, and Nevada Health Centers, Nevada Outreach Training Organization, the Office of Consumer Health Assistance, and St. Rose Dominican Hospital Dignity Health. These grantees will receive funds to help them with marketing, outreach, enrollment efforts throughout the open enrollment period. And I'm going to skip some of this because I think you know a lot of it. I'll go on to the next section. The navigator landscape for Plan Year 21 versus Plan Year 20 includes the differences from the number of full-time navigators. We revamped the funding structures and new coverage in Northern Nevada, and then also we revamped our funding structures. We have new coverage in Northern Nevada and decreases in in-person outreach opportunities. So the exchange is funding 26 navigators over 8 different agencies for Plan Year 21. Navigators and in-person assisters consist of public entities and private entities that communicate, educate, and enroll eligible individuals in Affordable Care Act qualified health plans and publicly funded healthcare through the multiple enrollment methods provided by the exchange. The exchange currently awards 26 FTEs. We've already been over that. Sorry, that got a little repetitive. In state fiscal year 20, the navigator entities were awarded with a maximum of $3,500 a month per full-time in-person assister, reimbursable on a billable hour basis. If a navigator entity had a reduction in billable hours, they would have had a subsequent reduction in reimbursements. Throughout the year, the billable hours for IPAs would fluctuate depending on demand and consumer need. For instance, there are much higher billable hour reimbursements during the open enrollment period and lower reimbursable hours during the special enrollment period. This reimbursement methodology made it difficult for our navigators to develop accurate cost projections and budgets. And the COVID-19 pandemic requiring the closure of non-essential businesses and the shelter-in-place orders beginning in March had a real detrimental impact on our navigator entities along with the billable hours that they were able to bill for. So in an effort to stabilize funding for our Navigator entities and partners and to provide more consistent and stable statewide pool of IPAs or in-person assisters for fiscal year 21, the exchange realigned the reimbursement methodology to be consistent with grant management best practices and reimbursement guidelines as directed by the Office of Grants Procurement, Coordination, and Management. This realignment includes the development and implementation of mutually agreed upon goals, objectives, and detailed work plans. And its evidence-based evaluation methods are used to gauge the performance of Navigator entity partners. Those reimbursements are based on maintenance of the full-time employee in-person assisters and progress towards the achievement of program goals. This provides our Navigator entities with the ability to focus on broader, longer-term goals to identify and assist eligible Nevada consumers with enrollment into qualified health plans. Take a quick break here. Wet my whistle, sorry. All right, so exchange platform and call center updates. That's been a work in progress for a whole year, and we've learned so much. So the exchange and our technology vendor Get Insured have spent much of the past year developing processes and policies by which we can operationalize our maintenance and operation portion of the contract. These processes and policies outline how the exchange and Get Insured coordinate the maintenance and enhancement of both platform improvements and our call center functions. In September, a significant portion of the exchange's staff resources went into testing the enhancements for defect resolutions and the eligibility platform. While most of the enhancements were designed to simplify and provide more ease of use behind the scenes, consumers can expect to see a more streamlined application experience with simplified questions this year. In early October, our exchange staff began building enhancement requests for plan year 22. I think I meant to, yeah, we're already talking about plan year 22, excuse me, yeah. So we're starting to build our list of enhancements that we'd like to see for our next plan year 22, open enrollment. And the exchange provides those requests to Get Insured, who then provides the exchange with an estimate which outlines the requirements and the costs associated with each change. Once the estimates are received, the exchange will determine if we will move forward with those changes depending on the level of effort and the availability of funding. Included in our plan year 22 wish list is a brokerage portal, which would allow broker agencies to manage all of their licensed brokers through a single page, improvements, along with some improvements to reconciliation tools and enhanced reporting capabilities. There's lots of things on our list, and of course, the exchange will keep the board of directors apprised of these enhancements in future board meetings. In March of 2020, the Consumer Assistance Call Center began working remotely. And as a result of call monitoring increased to ensure service levels were maintained through the transition of the remote work model. This includes live call monitoring and 27 scorecard categories to evaluate phone calls for each individual call center representative. The goal of meeting 85% of service levels has been met, but opportunities to improve the hold time experience and build rapport with consumers has also been identified. Exchange staff and our call center leadership have collaborated to make the consumer and broker enrollment assister interactive voice response system experience better, faster, and more efficient as an initial interaction with the exchange and our call center. Transitioning the call center to working remotely has allowed our vendor to recruit and hire 16 Nevada residents for the upcoming open enrollment period to work in our call center. The call center will be staffed with 50 full-time customer service representatives and will field calls 7 days a week from 9 a.m. to 5 p.m. Pacific Standard Time, excluding observed holidays. We have been very busy in terms of building a budget, and I want to thank our fiscal team. Jennifer Krupp, who is our Chief Financial Officer, has been fabulous, and we've worked through a lot this year. But the exchange has submitted our agency request budget to the Governor's Finance Office. We submitted that on September 4th, And we presented the requested budget to the GFO, or the Governor's Finance Office, along with the Legislative Council Bureau on September 23rd. Building a biannual budget in such a distinct time of uncertainty has been complex. Once again, the Affordable Care Act is under scrutiny, and determining how many newly unemployed Nevadans will be eligible for the exchange versus eligible for Medicaid, compounded by a worldwide pandemic and the urgency for Nevadans to have access to comprehensive health insurance, has all impacted the budgeting and the building process. The exchange includes as many known and unknown factors into budget development and projects as conservatively as possible to ensure that we have adequate resources to meet Nevada's needs. The exchange requested $18.8 million for state fiscal year 22 and $17.2 million for state budget fiscal year 23. And as has always been the case, the exchange is, of course, a self-funded state agency and operates solely from carrier premium fees and reserves. The agency requested 4 additional full-time employees to assist in the management of the duties absorbed as a result of our transition away from healthcare.gov. We asked for a health resource analyst to act as a lead librarian for all, and I say that with a lot of emphasis, all of the reports and data management and analysis that we provide to a variety of different stakeholders. We've also requested a second business process analyst in our reconciliation unit, who that unit is currently operating at a deficit and will require another employee in order to not only manage our current work, but the increase in our carriers will also require additional coordination. We required we requested a health program specialist to coordinate our outreach efforts, thus bringing the functionality of outreach into in-house, which is a preference and we have a preference out for an individual who is bilingual. And finally, we requested an additional program officer in the consumer assistance unit to assist with complex consumer cases by coordinating resolution with our exchange carriers. In addition to the new positions, the exchange has requested the reclassification of several executive positions to commensurate with the additional duties absorbed as a result of the transition, and then to align with comparable positions within the state, within similar state agencies. The governor's recommended budget will be announced after his State of the State address in January, and the legislature will make changes to that budget during the legislative session, which of course begins in February of 2021. Away we go with legislative session. Here we are thinking about that already too. Okay, so there's been a lot of really interesting engagement and work and partnerships and collaboration with within the state that I thought I would provide an update to you all with. As you're probably well aware, myself and our team are very committed to working closely with other statewide organizations, state agencies, and stakeholders to not only communicate about the importance of comprehensive health insurance, but to also educate, improve, and streamline our existing systems and programs throughout the state. The exchange's efforts to ensure cross-agency partnerships and collaborations have grown throughout the pandemic, and in response to the significant increase in unemployment and Medicaid enrollment. The exchange has partnered with the Department of Employment, Training, and Rehabilitation, otherwise known as DETR, to extend outreach of Nevada HealthLink services to the hundreds of thousands of Nevadans who are filing unemployment claims with that department. DETR will be sharing the exchange's open enrollment content on their social media pages and their web pages. And the exchange and DETR are working closely to create an insert or a mail stuffer that will be inserted into the mail that goes out to anybody who files for unemployment. The exchange has also worked with the communications team within the Department of Health and Human Services to do similar cross-promotion across social media pages, web pages, and email communication. The Division of Welfare and Supportive Services, otherwise known as DWSS, is the state agency that determines Medicaid eligibility and is a close partner of the exchange. Our two agencies share critical eligibility functionality through our connections to the Federal Data Services Hub, along with important consumer information as mandated by federal law, to ensure that consumers are routed, of course, to the appropriate program for health insurance coverage. DWSS has processed tens of thousands of Medicaid enrollments throughout this pandemic. The exchange has partnered with DWSS to include Nevada HealthLink informational inserts into the redetermination notices that were sent out in October. This insert notices Nevadans about open enrollment and the affordable options available through the exchange, and it is intended to reach Nevadans who will no longer be eligible for Medicaid as a result of their income raising to a point where they're no longer meeting Medicaid asset thresholds. In March of this year, the exchange began meeting with the staff at DWSS to explore a different partnership that I'm very excited about. Between the exchange's Navigator program and the state's Medicaid program, we want to provide outreach, or we provide already outreach and education services to Medicaid and Nevada checkup recipients. According to historical program records, roughly 25% of Navigator entities' time is spent assisting Medicaid and checkup recipients with post-eligibility activities as a part of the normal activities that occur throughout the Navigator program. As such, the exchange may be able to obtain a 50% federal match from CMS to provide these services to Medicaid recipients. A proposal was drafted and submitted as a part of Medicaid's eligibility and enrollment implementation advanced planning document, and IAPD, in July of 2020. If the proposal is accepted, the exchange could receive up to $633,644 over the course of a 2 years to fund and expand the outreach and education services provided to some of Nevada's most vulnerable populations. The exchange expects an update on that IAPD in the near future and will, of course, keep the board apprised of the outcome. The executive director, or me, is also an ex officio member of the Patient Protection Commission, which is a commission that Governor Sisolak put together with a group of people from all different walks of the health industry, healthcare industry, and healthcare fields. The commission has met several times over the past several months and has submitted and concluded to submit 2 requests for bill drafts. So they have 3 allocated bill draft requests and ended up submitting 2 of them. The first one would expand telehealth services, and the second would establish a state medical claims database. These requests are now with the Legislative Counsel Bureau and are being drafted. The commission will then vote on the finalized language before the Nevada legislature considers them in the 2021 legislative session. I am also appointed to the Advisory Committee on Medicaid Innovation. This committee focuses on the creation or the expansion of public and/or private prescription purchasing coalitions. It encourages coordination in private and public healthcare coverage, and it explores waiver opportunities to the U.S. Department of Health and Human Services. Finally, I have been very involved and provided information and guidance to Manat Health and Wakely Consulting, who are 2 private organizations that are responsible for producing the report that's been outlined in the Senate Concurrent Resolution number 10, a bill that was passed back in 2019's legislative session. SCR 10 directs the Legislative Commission on Healthcare to study the feasibility, the viability, and the design of a public healthcare insurance plan that may be offered to residents of Nevada. The exchange, of course, has been not only involved in those conversations, but will continue to monitor and analyze any bill that results from this study, and of course, keep the board apprised. It has not been boring, as usual, in the federal landscape in terms of the Affordable Care Act. And if I had a crystal ball, I would tell you what would happen, but I don't. So I will tell you what we know, because there are a lot of things that we don't know. So the information I'm going to provide is really just intended to provide a very brief overview. Super happy to answer any questions that the board might have. Of course, it's clear that the Affordable Care Act is going to be heard A case of whether or not to repeal the entirety of the ACA will be heard by the Supreme Court on November 10th. And the likely decisions will be brought in the summer of 2021. The Supreme Court has to first decide whether the plaintiffs have standing to bring the case forward, and the current question of standing relates to whether or how claimants are harmed if the penalty for not purchasing insurance is $0. The penalty used to be referred to as the individual mandate. If the complainants do have standing, the court will have to determine whether the individual mandate is constitutional. And if it is found to be constitutional, a determination will have to be made regarding whether any portion deemed unconstitutional can then be removed from the law. As currently highlighted in the news, of course, there's a new focus on this case as a result of the passing of Supreme Court Justice Ruth Bader Ginsburg. We don't know at this point whether or not a new justice may be appointed before the oral arguments in November, but we will, of course, closely monitor this case and look forward to reporting on this to the board. I will just add one bit of messaging because I've spent a lot of time talking to the press this week, and I know that this is going to be a continued conversation over the next month. I want to just mention that it's important for consumers to know that we believe there will be very little, if any, impact on Plan Year 21, and pandemics are an extremely bad time to be uninsured. So we're going to go with the messaging that get connected to comprehensive and affordable options with Nevada HealthLink. And let's wait until July or June before we worry about the outcome of this case. A lot can happen. A lot happens every hour of every day. So I think there's a lot that could happen between now and a decision. Another thing that does have an impact in the federal sphere that is applicable to the exchange is that the HEROES Act has failed to pass Congress, nor have we seen any other COVID-related relief packages. And of course, that's been in the news the last couple of days too. As you're aware, Congress has not reached any kind of agreements. If a bill is passed, it will likely have, if a bill had been passed and if the HEROES Act had been passed, it would have included an extension to the Pandemic Unemployment Assistance, which is known as PUA through the Department of Employment, Training, and Rehabilitation. It would have also had a federal exceptional circumstance, SEP, meaning healthcare.gov would have opened its own special enrollment period. And it would have had an exception of the PUA money from being counted in exchange income determinations, which would have brought the exchange treatment in line with the way that Medicaid and CHIP is being treated in terms of counting income. The same is true. So there was the passage of the agreement and the approval of the lost wages assistance in early August. There's a typo there. The president signed an executive order known as the Memorandum of Authorizing the Other Needs Assistance Program for Major Disaster Declarations Related to the Coronavirus Disease 2019. The order provides a means to extend $300 worth of weekly additional federal unemployment income through a lost wages assistance program to unemployed workers due to the coronavirus. The program requires states to enter into an agreement with the federal government, as well as $100 a week contribution from the state in order for the 300 funds to be dispersed. Nevada is currently working on implementation, as is the case with the CARES Act and the PUA money. This income will be counted for exchange determination. So that income will be counted when you make your determination on income for exchange related purposes. But it will not, again, be counted for Medicaid and CHIP determinations. The exchange has provided consumers with resources. We've got a policy page on our website that's designed specifically for not only consumers, but for our enrollment professionals, navigators, and brokers that outlines in a very simplified way what these policies mean. I'm very proud of the policy team and the work that they've done to analyze that and give good guidance. And then finally, there's an issue that has been hot in my office all week, and that is a premium rebate credit. Due to a reduction in non-emergency medical care during the COVID pandemic, many insurers nationally are seeing a lower number of claims, which is leading them to higher than expected profits. Since health insurance carriers have medical loss ratios, which regulate their allowed administrative costs versus claim payments, they must provide MLR rebates to consumers after the plan year conclusions. CMS issued guidance in June authorizing insurers to provide MLR rebates for 2020 prior to the conclusion of the plan year, directly related to the COVID pandemic. In August, CMS released further guidance on permitting premium rebates for the current plan year and the effects on the premium tax credits and state-based exchanges' abilities to exercise approval and authority over those rebates. Multiple, 4 Nevada carriers issued rebates in an attempt to mitigate their MLR exposure prior to clarity regarding what the state's approval was and involvement should be. Those rebates will affect the subsidy levels that were provided to carriers from the federal government, which will subsequently affect the tax liabilities for consumers and the role of exchanges in reporting APTC amounts to consumers for the purposes of reconciliation. We have some significant technological changes to our platform and our architecture that are required to accommodate the latest guidance, and the unanticipated COVID adaptation is creating a significant cost burden for our exchanges. And I will add that after this was put to press, we have a work program that is to be heard on October 22nd, requesting to use CARES Act funds to help us afford the costs of making a significant change that will allow for Nevada consumers to have correct 1095s and to accurately reflect the tax credits or the APTC funds that should have gone to our carriers for the months that the carriers gave these premium credit rebates. I'm almost done, I promise. All right, so the exchange enters into plan year 21 with a continued commitment to the best consumer, carrier, and enrollment professional experience possible. Every action that we take, whether it's through our technology, our marketing, or outreach, is focused on ensuring Nevadans are getting the most comprehensive health insurance the state has to offer. This year is not free from adversity. However, the exchange remains steadfast in our organizational mission and vision and will rise to each challenge with the best interest of Nevadans in mind. With that, Madam Chair, I am happy to take any questions from the board.
Wow, that was a mouthful. And what an outstanding, thorough, just such a well thought out, and overall, except for a few of the very last items, super positive. And I'm glad that we have you back in the fold and the family to deal with these challenges now, such as premium rebate. And I'm now going to open this up for any questions from our board members or anyone else.
Not seeing any questions on the chat.
Jose, for the record, just want to say thank you, Heather. That's a lot of, I wrote it in the chat too, but a lot of detail and a lot of work and during these very challenging times. So thank you for your leadership on this. And I second what our chairwoman said. We are very, very happy to have you back.
Thank you. I will make sure that the rest of the team who does most of the harder parts hears that. Thank you very much.
I just have mostly a lot of congratulations. When we talked about the overview plan year 2021, I was so excited after, a couple years of seeing shrinking participants to see that you had 2 additional QHP carriers. Bravo.
Yay, them.
And do you guys actively solicit, or do they come up to you and beg to be part of it? I know before we had to beg on our knees and cry. Are people kind of excited about the program and coming to us more?
Well, it's been about 3 years since I had to beg and cry, so that's a nice feeling. No, we did not do very much active solicitation. I think this has a lot to do with the changing dynamic in the market, some stabilization of our market, and potential growth.
Excellent. And following that same thought, wow, how exciting it is to see in the rural areas the expanded options. OMG. I feel, my gosh. I mean, we were down to like one for many of our rural people, and what you have done is phenomenal. So ring the bell. Great job, you guys, that our rules in most area are actually going to have more than one option. Bravo, woohoo!
We're very excited for them. 35 plans and 3 different carriers.
Beautiful. As my DVD physical trainer says, it's a beautiful thing. And when the average rate was 4.2% for on-exchange plans, of course, although my husband says never compare, right? I'm always curious for the non-exchange plans in the private world. What was their, and some of our brokers might know this, increase?
This is Heather. And Barbara, please correct me if I'm wrong, Commissioner Richardson. I believe it was 4.4% for off exchange and 4.2 average. These are averages on exchange.
I just like to know where we fall for the consumer. Excellent, excellent. And I'm just very excited about your campaign, looking at everything, and we're going to hear more to come. But the targeting of the unemployed Nevadans and the you know, as usual, diverse populations, but really responding to the effects of the COVID-19 in our Nevada population. You guys are doing, as always, an amazing job. And
Madam Chair, you just reminded me, I'm sorry to interrupt. You reminded me of something that I didn't, I neglected to put into my report, but it's on top of my mind because we hosted meetings yesterday, 2 different prep sessions. You know, we used to do those in person, but we hosted those virtually yesterday to inform our stakeholders. We had over 200 attendees in the first one, and I want to say close to 200 in the second. And that we have posted those to our webpage. So if you want to take a look at that presentation, you're more than welcome to. You reminded me of that because I got to see the teaser that you guys will see hopefully today, as long as all the tech works. And it is really a campaign to be proud of.
Oh, this is so exciting. And that then goes to what I'm sure you said yesterday. I would just pass on congratulations to the recipients of our grants, both the broker agents and the 8 in-person Assistant Navigator guarantees, which I'm sure when you did your program, you gave them a shout out.
We said hello, I think. Congratulations to them on my board meeting too, yes.
Yeah, so bravo for them, because you know, they have to go a little second mile to get that grant, and shows such support and such a desire to work a little harder for very little, but for our common mission and vision. So it's beautiful. And then on the exchange platform call center, as we were talking about in our prior board meeting, a lot of the changes they needed, you know, little fixes they need to constantly tweak as we roll things out. And a lot of it, like the iceberg, we only see the tip of it. We don't always see the bottom. But you mentioned how there is, though, however, a few changes that have made it more streamlined for the applicant with simplified questions. And I just want to say again, yay, because more user-friendly we get, better it is. And that's great. I keep saying now that it's had so many changes, I want to go in personally and do it and see how streamlined it is. I haven't had a chance, but of course, anything from the old Xerox days would be amazing. And then when you talked about the exchange platform, available funding, you know, I was just wondering with the platform, and shame on me, but On the contract we made with the platform, our new people, we have a set contract. How often do we have to renegotiate it? And I'm sure there are set prices for every time they give us some new fancy, a new fancy program to add to our current portfolio of different services. And so is there ever any concern? Are we pretty, I'm sure we are set that with some other reasons that we might worry about cost, that this could ever get excessively out of hand, or is pretty much capped and we're good?
That's a good question, Madam Chair. So we have a negotiated contract for, I want to say it's through 2024 with our existing vendor. We have had some changes to that contract and to add some authority, so budgetary authority to the contract to support some of the enhancements that we've requested, including the extension of our open enrollment period to support the changes necessary for technology and our call center. And so we have made some changes like that. We had negotiated into our original contract a bank of programmer hours because we anticipated needing their time and energy in order to make some enhancements throughout the years of the contract's duration. And we still have a healthy budget of those hours that, you know, we will likely work through. I won't say that we aren't going to probably maybe appear before the Board of Examiners again to make slight changes to the contract to add additional authority so that we can support some of these things like the brokerage portal. But for now, you know, our focus and our focus has always been to really keep a rein on our contractual authority and to make sure that we're continuing to deliver on the promise that we made, which is that we would do it cheaper and we would do it better than the federal government.
And you are. Well, that's good to know about the banked hours. That was very, very thoughtful. A lot of forethought there. And you know, when we come to the end of this next enrollment period, I see how you talked about the call center with the 50 full-time customer service representatives, and the 7 days a week, 9 to 5. And on that last week or so, are you extending the hours, or is it hardcore? Is that it?
Yes, we are. We've negotiated later hours on deadline days flowing into the ending of open enrollment.
Oh, that's great, because I'm always one of those people that needs that. And then I was very excited with your skeletal crew that you have. I don't know how you've done what you have done on the number of employees that you currently have. How many is it?
23.
23. And I'm so excited that you were going to have these additional employees. And
we'll see.
really,
we have to get it through into the governor's request and through the legislature. So we're hopeful, and we do have the budgetary authority to support all of that very comfortably.
There you go. Next question, and I'm so excited about it. And then this is a huge congratulations. You know, you guys independently are rock stars. You have created this amazing entity, the exchange, and it is getting to be a well-oiled machine. You have stayed in your budget. You are doing it for less, with a higher quality. In healthcare, they always tell us doctors give a better value at a lower cost. It's really hard to give more for less, but you guys have done it. But here, I have to say that we all know the way an organization is really most successful is not how it is out on an island, but how it partners. And oh my gosh, your whole state updates, the first multiple issues you brought up, this is why you guys really rock, is because of the way you have partnered. This is amazing partnerships, and congratulations to all of you. Working with Dieter, getting yourself in there, working with them helping you notify. all of their clients about yourself. The Division of Welfare and Supportive Services, working with them, getting your little flyer, your card in with them. I mean, I got to say, you know, the real success where we are just going to even beat any benchmarks that we ever expected to is because of this phenomenal outreach and partnerships with all of your other organizations in the state that want to share a vision that everybody has access to healthcare. You guys are just doing phenomenal. On the last part here, this could even be one of my last questions, but the public option study. When do you think we'll hear anything? Do they have a deadline for the deliverables?
I believe that they, I have an email that I haven't read entirely yet, but I believe that their due date is to get the Senate Majority Leader, Senator Cannizzaro, a report by December, which will guide any legislation that she puts forward during the February session, or the session that starts in February.
Excellent. Well, I know all of us are not only dying to hear what they came up with, and ideally we would be intimately involved with that if something comes to fruition there, depending again on Affordable Access Care court case and other multiple issues. So many balls in the air that, as you say, you don't have a crystal ball, we don't know what's going to happen, but we're going to remain optimistic, and I'm excited that some of these things, regardless of what happens, and we're hoping for the best, that our plan year 2020 will be moving on. And I want to thank you all for this amazing work you're doing. And I'm so proud to be part of this. And you really should be proud of yourselves. So thank you guys. And is there any other questions from anyone else on this?
Don't be shy.
I'm not seeing any hands up.
Okay, so then let me see now. I have my agenda here, if I can find it. But I think since I'm having trouble finding it right now, we're going to the
Marketing and outreach update.
marketing. Yeah, well, let's go on to there while I look for my agenda again.
Thanks, Chair Jameson. Hi, everybody. Janelle Davis, Communications Officer for the Exchange. It's nice to see everybody. Hi, Sarah. That's always a hard report to follow. And so my report is short and sweet because our Executive Director does such a comprehensive job. So over the past several months, and I think Patty and Dave, our executive assistants from Penna Powers, are going to share their screens right now while I read my report so you guys can get a visual along with this. But I'm going to go ahead and get started here. So over the past several months, our communications team and Penna Powers have been hard at work in developing and defining a new open enrollment creative campaign for the 2021 open enrollment period. The media plan and marketing package has a goal to promote OEP, which obviously has been extended, so it's November 1st to January 15th of next year. Our new ad campaign is called Reasons, and it focuses on Nevadans' need for coverage and their reason for getting enrolled in a qualified health insurance plan. The campaign hones in on the idea that no one really wants to think about health insurance, but everyone has a reason to get it. Some people get a health insurance plan because we offer the 10 essential health benefits, or the generous subsidies that we offer, or because a loved one may need it. It could be used for a chronic illness or mental health. No matter your reason, our campaign states that Nevada HealthLink wants to recognize everyone's personal reason for getting covered. So we all know that health insurance is not an easy sell. So each year the exchange strives to create both emotive and demonstrative ad campaigns that compel our target audiences to listen, take note, and make an action. So while this year is no different, the call for Nevadans to act by getting insured has never been more important, as you heard from Heather's remarks. With so many Nevadans deeply affected by COVID-19 on multiple levels, promoting Nevada HealthLink's resources in a profound and meaningful manner is essential. Reasons is designed on a responsive campaign platform that allows for niche messages to various target audiences and acknowledges the multiple ethnicities and cultures that Nevada represents. The campaign has the flexibility to thrive and be effective against our ever-evolving normal as our state forges ahead. So since our last board meeting, I think in July, the exchange, Penna Powers, and our community stakeholders were in the midst of an off-season campaign, as well as balancing a public health crisis in response to COVID-19. The exchange made many adjustments in our outreach strategy and messaging due to the pandemic. The focus was more on outreach events going to a virtual space, and ensured that community partners had social media toolkits to help promote our message about special enrollment periods. In response to the exchange's regulation to institute the exceptional circumstance special enrollment period, Nevada HealthLink continued with a marketing campaign to inform Nevadans of the SEP and inspire them to enroll at nevadahealthlink.com. In the remaining months of the off-season campaign, the exchange continued to encourage the uninsured and underinsured to shop and explore qualified health plans sold through Nevada HealthLink and to consider Nevada HealthLink as an alternative option to COBRA plans due to job layoff or as an interim health insurance alternative while furloughed. Additional messages to exchange consumers stress the concept of now is not the time to cancel your health insurance coverage and advised consumers to reach out to their insurance carrier to see if they qualified for additional grace periods or if they qualified for additional subsidies in order to reduce those monthly premium costs. Secondarily, messaging brought awareness of the increased fraudulent activity by out-of-state brokers messaging Nevadans to purchase unnecessary additional COVID-19 insurance coverage. Nevada HealthLink also participated in cross-promoting the Nevada Health Response messaging out of the governor's office to all Nevadans in need of resources during the pandemic. So for this upcoming open enrollment ad campaign, Nevada HealthLink and our marketing partner developed a traditional advertising campaign, which includes television, radio, which is different ads and lifestyle programs, podcasts, digital and online video, such as YouTube and Snapchat, outdoor, transit in Reno, search engine optimization, SEO, social content marketing, over the top such as Hulu and streaming services, native content and video for display and social advertising. And so I'm just going to review a little bit of the spots and then we will show you the video. So there's 5 creative television spots. They're entitled Single Mother, Injury, Driver, Checkup, and Anthem. That's not the insurance company. It's just a compilation of all of these different Nevadans and what their reason is to enroll in coverage. So each spot portrays an individual's reasons for obtaining coverage. For example, the single mom gets coverage for her child. A wife has coverage because of an injury occurred and she had to go to the hospital. The self-employed Lyft driver gets coverage because of his pre-existing asthma condition. And then Anthem is a combination of all of those spots. So Patty and Dave, I'll turn it over to you and we can see a little clip here of our ad campaign, which we're really proud of, and I hope you guys see it.
We enroll because we can't afford to let a sudden injury empty our bank account. Whatever your reason, we're here for you.
The reason I enroll is so I can get covered and stay covered, even after I get back on my feet.
Whatever your reason, we're here for you. The reason I enroll is so that when he's sick, going to the doctor doesn't have to be a difficult choice. Whatever your reason, we're here for you.
The reason I enroll is so my asthma, it doesn't ever keep me from working.
Whatever your reason, we're here for you.
La razón por la que me inscribo es porque mantener mi diabetes bajo control no debería controlar la forma en que vivo.
Cualquiera que sea tu razón, estamos aquí para usted. I enroll because going to the doctor shouldn't be a difficult choice.
The reason I enroll is so I can get covered and stay covered, even after I get back on my feet.
Because we can't afford not to be.
Because I can't working or keep me from living my life to the fullest.
Whatever your reason, we're here for you.
Yay, thanks, Patty. I know the video is slightly lagging there, but I think you get the idea, and these will be posted on our webpage and our YouTube page. And you'll start seeing it on TV, but after the election. So again, really proud of this campaign. I think it really encompasses, the reasons why people get covered, especially in the state of Nevada. So the media plan is similar to the plan that was presented to the board in July, with just a few changes, shifting budgets from radio to TV, adding and or removing a few vendors to pursue new media opportunities, and pull back partnerships with vendors that were either operating intermittently or closed due to the pandemic. For TV placement, the exchange has decided not to launch the advertisements until after the presidential elections, as I just said. The key target audiences remain the young and healthy, and more specifically ages 26 to 45. This year's campaign also serves to speak loudly and directly to the recently unemployed, especially in the hospitality and casino sectors, as well as contractors, gig and self-employed workers, and ethnic populations who may need more coaxing. And also we have a pretty robust communications plan to speak to those individuals who are not eligible for Medicaid and falling between the gaps. While the advertising campaign does much of the heavy lifting during OEP, the overall marketing strategy and effort remains the driving force that provides this ongoing synergy between all the marketing that Nevada HealthLink does. As a fully functioning state-based exchange, Nevada HealthLink continues to vigorously target and communicate tailored email messages to various segments of our enrollee audiences. For example, we developed a comprehensive email marketing strategy to reach out to existing enrollees, people who have started their application but have not finished it, and those account transfers received from Nevada's Medicaid agency. Our team also reaches audiences through timely, relevant, organic social media and blog content. In partnership with Penna Powers, we are creating updated resource guides and fact sheets in both English and Spanish, and some resources will also be developed in the top 4 Asian-speaking languages in Nevada to ensure we're reaching communities at a grassroots level. The resource guides include the Broker and Navigator in-person locations and contact information, things you need to enroll, and also examples of the top surgeries in Nevada and what that would cost without insurance. We also included the federal poverty level income guidelines so that consumers can see how much insurance will cost and the benefits that they get. Another important element within communications is the relationship and coordination with stakeholders. This includes our carriers, our brokers, navigators, state level legislative supporters, state agencies, and all those community partners that we talked about earlier. This helps complement and cross-promote our Nevada HealthLink information, as well as our important message. As far as public relations and media relations are concerned, that's an ongoing effort. Heather has spoken to the press quite frequently in the last couple of weeks. There's a lot going on. These are designed to strike the perfect proactive and reactive balance and garner ongoing media interest for Nevada HealthLink. Our PR partner, the Warren Group, has created a comprehensive strategy going into this open enrollment season. This includes multiple press releases, and some will also be pushed out in Spanish. Op-ed planning, pitching the media, securing media interviews with local media. We are planning a virtual press conference for Monday, November 2nd, so right after open enrollment starts. As Heather said too, we had our virtual prep sessions yesterday. They were very well attended, lots of questions. We are following up with an email to all of our stakeholders, and all of our resources will be available in case they didn't get to attend. And then we also are preparing for some city council presentations, also in a virtual space. So even though our new normal is a little different, we are very active in a virtual space to get our message out there to Nevadans. And with that, Madam Chair, I'll take any questions the board has. Thank you.
And does anybody have any comments or questions?
Not seeing any questions on this side.
Okay, I just wanted to say that it was excellent report, and you guys, I couldn't know where to begin, but how you guys know with all the challenge you have, as you say, to get people to sign up, to convince them why they need healthcare and come on board, and now you have to deal with virtual. I mean, oh my gosh! Congratulations, you're just as flexible as our exchanges, and it's really an amazing job you're doing. I would like to say that in medicine, often we're given a hard time because people think we need to talk in more terms of just the lay public, and sometimes medically they don't quite understand what we're saying. And I would only say that you guys have your own language too. And then on your very last slide, get started, and I may be this way because I'm a gynecologist, but on that slide, I would have just made the get started, I would have shown the whole bubble because the way it looks is a little symbolic. That's all I'll say.
Duly noted. Thank you.
You're so welcome. And then I think now I did just have my agenda up. Oh, here it is. And let's see, we are up to discussion and possible action items regarding dates, times for future meetings, and maybe we can have our executive director let us know about dates and times right after. If there's anyone on the board that would like to make any recommendations first for items to be discussed. I have no specific recommendations, so our executive director, Ms. Korbulik, could let us know about our next date and time.
Thank you, Madam Chair. Tiffany Davis, who is the facilitator of our board meetings, will reach out to all of you to set a next time. We don't have a firm date, partly because we were hoping to get to probably January in order to get through the open enrollment period so we can provide you with a comprehensive update. At that meeting, we'll also have to approve several different reports that are due to the legislature and to the governor's office that are statutorily required. So we're thinking it's probably going to be in January, and we'll be back in touch.
Oh, and you just reminded me of something I was going to say after that wonderful slideshow from our marketing team. I just thrilled every time you put up a slide and it said January. Didn't you guys just do the happy feet dance? Congratulations, and thank the board, special meeting, getting the extended enrollment period. That was another beautiful thing to keep saying, that we have this extended enrollment period. We are gonna rock this year, you guys. thank you so much. And now, any other public comments?
Not seeing any in the chat or raised hands, but we do have 6 people that are joined just on the phone. If you'd like, I can unmute them and see if they have any questions.
Okay.
Go ahead and do that, Katie. Does anybody on the phone have any public comment? And this is another moment of opportunity for individuals who are attendees to make public comment.
It's either
I think
have
we
to
have-
pay 6 months or you have to do monthly. If
I
you
think
do
that's
monthly,
some background noise for somebody, Katie. So
do
give it
monthly
maybe.
with a
Let's
routing
mute
number.
those lines again.
You don't have a 6
We
month
don't need to like monthly payment.
If we could do that. And if we could then, one more check. Once you've done that mute, go ahead and check if there's anybody who's entered anything into the chat. Raised hands. I don't see any, but I might not have the same access as you.
Nope, I'm not seeing any raised hands or questions.
Okay.
Well, in that case, oh, can you hear me? Yeah?
Yes.
Okay.
Yeah.
In that case, no further public comment. I would like to have any board member that would like to move to we adjourn, and I look forward to an amazing enrollment period.
Thank you.
Okay, I think they might all be muted, but we don't have to have a motion. It's technically okay to actually just adjourn when the meeting is ended. So
Sorry.
we are now. Okay, thank you, Jose. Move to adjourn, and we have adjourned. Thank you, everybody.
All
Thank
right.
you for the
Bye,
increasing-
everybody. Thank you,
Bye.
Heather and
Thank you.
staff. Good job.
Thank you.
Woo!